Sola Florence Adefunke, a 300-level student, healthcare management and nursing of Joint Professional Training and Support International, in collaboration with Global West University Togo, South American University USA, and Pan American College California. I will be presenting a brief seminar paper on the theme, the presence of hepatitis B envelope antibody in a patient who has previously screened for the surface antigen. What is hepatitis B? Hepatitis B is a virus that infects the liver and can lead to acute and chronic liver disease. It is a global disease of public health importance. It is a DNA virus belonging to the family of Hepanaviridae and has some compound in its structure that can be tested to determine if the virus is present or active in a person's body. These structures are called antigens and they are capable of stimulating antibody response. The antigen and antibodies associated with hepatitis B are called viral markers. For example, there is the surface antigen that is used for screening patients. It tests if the virus is present in a person or not. When a person is infected with hepatitis B, this surface antigen will become present in his or her serum and will remain positive for life. However, these viral markers alone is limited as it does not tell if a person is immune or if the virus is actively multiplying in a person's body or if the person is infective to pass the infection to another person. The envelope antigen become present in the serum of individual during the early phase of hepatitis B virus HBV. Infectivity and active multiplication of the virus within cells. However, during recovery from acute hepatitis B, it stimulates an antibody response called hepatitis B envelope antibody, and it remains detectable for many years after recovery from acute HBV hepatitis B virus infection. So, further evaluation of hepatitis B envelope antibody in a patient who has been screened and is positive for surface antigens is theoretically advantageous to provide more information on the patient's clinical state. A positive hepatitis B envelope antibody results can be indicate that 1. The acute infectious stage of the infection has ended through the surface antigen is positive. And secondly, in patients who develop chronic infection and use antiviral medications, a positive envelope antibody can indicate good clinical response. I'm using this opportunity given to me to tell all my viewers and listeners that we should please go to our nearest diagnosis center to know our hepatitis B status today so that we can reduce the risk of hepatitis B in our community. And this will also help us not to transfer this disease from one person to another, because hepatitis B is a communicable disease that can be transferred from one person to another. But when we have been screened and either we are positive or negative, but it will give us assurance that I'm positive or I'm negative, so that we will be able to reduce the risk of transferring this acute disease from one person to another, and we will be able to live long